I like that phrase, the people at the front don't know the answers. I'm going to completely take that on board and go with it. And you're thinking, God, this has been a long session. Interesting, but long session, you know, 2 hours after lunch. It's already the graveyard slot. And I'm booked for 25 minutes, and it's 15 minutes till the coffee break. So I'm going to run into your coffee break, and you're starting to smell the coffee. Your bladders are starting to get a bit full. So I've got a real tough job here. The good news is that we may not take 25 minutes, so you may get to coffee, if not quite on time, but not long after you're supposed to be. And the really good news is that I'm not going to talk for very long. And the bad news is the reason I'm not going to talk for very long is because you're the ones who are going to do something. So the quicker you can do it, the quicker we get to coffee, okay? So this is a session in 2 parts. Part 1 is me saying something very quickly about the development of the service user feedback and outcomes guide, sort of where it's come from and what we're doing with it now. And then the second bit is you doing the work, you telling us what it is that works. We know that this is a really difficult thing. There are no obvious answers. There are some ideas, but to make it really work, it's down to us all collaborating to share our knowledge, share our learning, share what practice of doing this actually feels like. Going down some cul-de-sacs where things we think might be useful actually turn out not to work, and hopefully going down some roads which are really fruitful and help us realize that there's something really good in this. Okay, so part 1. This is a reminder of the CYP IAPT model, which you don't need a reminder of because we've been talking about it all day and you're all immersed in it or about to be immersed in it if you're coming in at phase 2. Just quick things to emphasize. One is that there is this background of strong service user voice at all levels within the organization. That's the fundamental bedrock of the IAPT program, as I understand it. And then laid on top of that are many elements. These are the 4 that stand out for me. So you've got to have really good effective services, which mean you've got the IT systems in place, you've got the admin systems in place, you've got systems which deliver the best use of the limited resources that are all working with in the most effective way. Then you do what is likely to work. So you draw on the evidence, you work collaboratively with the young person and the family on what their goals and wishes are, you share your expertise, you put those 2 things together, and you start the intervention doing what you think is the most likely thing to work. That's where you start, but along the way, you can go off track. We know that where you start with an intervention doesn't mean to say that that's the route that you just stay on and plow on regardless. There are many places where we can go off track as therapists. And so for me, the really important bit about the service user feedback, about the tools, is that it helps us as clinicians do a better job. And I won't say much more about that because I think Peter said that very eloquently this morning. The young people said very clearly why they thought it was important. So I won't do the why bother bit. And then embedded in that, the bit that really makes this effective, I think, more and more as this project's gone on, I think that it's about having really good supervisors who can help us as clinicians understand the feedback that we're getting from young people and service users and their families to really help us challenge what that information means so that we don't go down a route of thinking, well, you know, the young person saying that they didn't understand a word of what I said in this session, and they feel they're getting worse, and they feel they're moving further away from their goals. But, you know, I've had 6 years of training, and I know that what they're saying isn't really right, and so I'm going to not go along with that. It's easy for us as clinicians to create stories which are unhelpful and don't challenge our existing views of the work that we do. And if we're going to get better at what we do, we need to be able to have those challenges. And I think the supervisors are really helpful people to help us do that. Okay. Right. 2 documents that you may want to be familiar with. This one, for people in phase 1, you should be familiar with this thick, I haven't brought one along because it's too heavy to carry, thick, daunting document when you first see it, but once you start to get to use it, you realize that actually what it's putting across is fairly straightforward. It's simply asking, what do you want to change? How are you doing in making those changes, and how are we working well together? These are tools which have been developed under the really helpful leadership of Miranda Wolpert that help us do that. The other document, which you may be less familiar with, is this one, which is a thin document, which is an attempt at saying, look, we know that using these service user feedback tools is not straightforward. Here, rather than just saying, here you go, these are some initial ideas about the sorts of things that you might want to try, which might be helpful, and a sort of a steer away from some of the things that might be really unhelpful and not helpful to try. I've edited it, but I can't take any credit for it being my work. This is work that's been drawn on a number of sources around the evidence base that's already out there from people like Mike Lambert and Len Bickman and John Vise and others, Barry Duncan and Scott Miller, as well as lots of learning from the core collaboration group, the learning collaboration, which is about using outcomes tools more effectively, so drawing a lot of that and drawing on work that colleagues of mine have been doing in Hertfordshire as well. So it's nicking lots of ideas and trying to summarize it into this document. This is version 1. We are in the process of developing version 2, and part of that has been talking to various clinicians around the place. I'm a psychologist. I get to meet a lot of psychologists, so a lot of it has been talking to psychologists, just because they're much more accessible to me, but also speaking to service users. We've got a sort of an ongoing discussion with child psychotherapists, next week meeting with representatives from family therapy, and following that youth counselling early in where are we? What month is it? July. So that's in August I'll be doing that. Yeah. Okay, so this is part of a bigger collaborative process, and the thing that Miranda mentioned about the survey monkey that's going out, that's also helpful in terms of you feeding back, because we don't have the answers here at the front. You may have a lot of them, and it's important that we really draw on your learning from this year. This is what this conference is about. But also, so phase 2 of this document should be better than this one. And then once we've had another year of this, version 3 will be much better still, and then eventually we want it to have a life of its own. So that's what this session's about. It's about you helping me write version 2 of this. So here's a reminder about why just outcome monitoring isn't good enough. This is a cartoon that a young person drew after a discussion we had about outcome monitoring and its value. Here is a clinician who has perfectly monitored this patient, every heartbeat, every breath, every dose of medication, and the patient's died. Perfect outcome monitoring, but unless you use the data that you get back, then it doesn't count for much. So I won't say much about this. This is just about the sort of process of how we might want to use some of these tools. So you track progress, you look for off-track clues. Are we on the right lines or not? Sorry, this is difficult to read. You discuss and understand both with the young person and in supervision and with colleagues. You devise a plan to get things back on track, and then you have a go at doing that plan, and you go round and round and round. So plan, do, study, act. And each session, you kind of go round that loop. And the bit that goes out of here, what I should have added in, was about supervision, again, being completely the key to help us make sense of the information that we're getting back. Right, that's part 1. That's all I'm going to say. The next bit is part 2, what I would like you to do to wake you up a bit is to find your conference packs if you put them in your bag. Reach into your conference pack, and inside there should be a piece of paper that looks like this. So wave your piece of paper when you found it. Excellent. Okay, right. What this piece of paper is this is a feedback tool. It's for you to feed back your tips and ideas about what you've learned so far. So for those of you who've been doing this either as part one, phase one of IAPT, or even if you've been using outcome monitoring. I've got people walking out. This is the problem with it's the problem with when you get the feedback. You've got to get it early in the session, otherwise the people leave before you finish the session. You don't get the feedback. So there's a lesson. Okay, so this is a feedback tool. What we want is for you to share your tips, your ideas about what you've learned so far from using the service user and feedback tools. So these are the lessons that we've all learned together, because I'm doing this as well, and I know that it's not easy. So what I'd like you to do in the next 10 minutes, maybe 5 minutes, what I'd like, rather than all starting with question 1 and not getting to question 4, I'm going to try splitting up the room. So this bit of the room, if you start with question 1, this bit down the middle here, so you lot there, if you start with question 2, you do question 3, and this side do question 4, or just start with question 4. They're fairly self-explanatory. So as a service manager or supervisor or commissioner or young person, wherever you're coming from, so this lot start with one thing I've learned that works well in terms of using the service user feedback. So one thing that's worked well, you lot, the best thing a service manager can do to make this work well, okay? You lot here is start with the best thing a supervisor can do to help all this work is. So these are your tips about what will work. And you lot over there, one thing that surprised me in a good way about using the outcome tool. So these are, what we want to do is to collect in these tips and ideas that we can then share with other people doing this, so that people can learn and we can roll it forward. Okay? So you've got 5 minutes to do this, and then there's 300 people in the room, so I'll just have time for one tip from each of you. We're going to run late, and then we'll stop. Okay? So 5 minutes, and then we'll just take 1 or 2, and then I'll stop with a video, which for me sums up what being involved in IAPT is like. Okay? Right, over to you. I'm getting some feedback that we should move on. So what I'm going to do is just very quickly, I'm going to take one tip from each section of the room. So we're just going to have 4, and then what I'd like you to do is to hand in other things that you may have written. So this group here. So one thing I've learned works well is, who's going to volunteer one thing that works well? Can people hear that? So the tip over there was using the goal-based outcome measure to agree goals collaboratively. Okay, fantastic. So this group here, you were on the question, the best thing a service manager can do to support this idea, this model is, someone going to volunteer something?
One of the key things is actually just really, really listen to what's going on and how it's working and what the issues are, and try and work to resolve them, and really try and find ways to enable through technology as well. Try and make this as easy and simple, and I think there are lessons to be learned from trying to do that better.
Okay, brilliant, thank you. So the group 3, the best thing a supervisor can do that's helpful is?
Understand the needs of therapists, the feedback, so because by working with a therapist you can improve practice in the just way as the therapists themselves can help the patient improve their mental health.
Brilliant, thank you. And the last but not least group, so one thing that surprised me in a good way, about using these tools?
In my experience, young people and parents really like using the forms and are really interested in what they say, whether it confirms the current formulation or whether actually it raises questions.
Right, brilliant, thank you. Okay, so if you can leave those things with you, I'm going to close with a video about what it feels to me, and it may have some resonance with you, about being involved in IAPT. Here we go. Right, okay, we don't know how it's ending.